Hey, future nurses. This is NurseEdScholar here. I'm bringing you another overview of an assessment. So today we're going to look at the abdominal assessment. And as nursing students, understand that the art of, really gathering subjective and objective data is crucial in every assessment that you do. So let's dive into examining the abdominal area. So when we start gathering subjective information, we want we're going to ask things from what's their appetite, their weight, how's their weight been? Has it been fluctuating? Are they having any kind of abdominal pain? In addition, we're going to ask about any difficulty swallowing. What's their dietary intake? Have there been any nausea and vomiting? Because we really need to know what the client's experiences are. Um, we're going to continue with asking questions about um, tolerance to certain foods, medications. Are they taking any medications, even if it's Tums, Pepto-Bismol? What are they taking? How are their bowel movements, and any abdominal issues or any abdominal surgeries. Because, gathering all this information really gives us a key of what's going on with the client's abdominal condition. So when we move on to gathering, data, objective data, going to use that hands-on approach. And, you're going to do inspection, auscultation, percussion, palpation. Make sure your hands are warm. Make sure that stethoscope, that diaphragm is warm, because we really want to be considerate to the patient. Usually, if you can, you want to make sure that the patient's bladder is empty. Um, and of course, remember to examine the painful areas last. Um, let's see. So, like I said before, remember this. Remember when you're performing an abdominal assessment, the order is inspection, auscultation, percussion, and palpation. When you go into looking at uh, auscultating the abdomen and inspecting the abdomen, you want to make sure that you want to make sure that when you're looking at the abdomen, is it flat? Is it round? Is it concave? Is it protuberant? Um, you're looking for asymmetry. You're looking for any kind of masses. Where's the umbilicus? Is it midline? Is it inverted? Um, you want to make sure that the abdomen is smooth. Is it even? And then when we auscultate, we're listening for bowel sounds in all four quadrants. Listening for normal bowel sounds, like pitch sounds, and you should hear something every like maybe five to, I don't know, 20, 30 times in a minute. That gurgling sound, so we're listening for normal, hypoactive, hyperactive vowel sounds, okay? And remember, when you're listening, you have to listen for 5 minutes. When you're like, oh, I don't know if I hear anything. So you listen for 5 minutes when you're thinking there are absent vowel sounds before determining that they are actually missing. So you have to listen for 5 minutes. Okay. And then don't forget, when you're looking at the abdomen, look for any kind of pulsations from the aorta. Um, that may be around the epigastric area. You're looking, maybe, they may have some peristaltic waves going across the abdomen. So you're looking for that as well. Now, let's see, we've done inspection, we've done auscultation, um, percussion. you know, percussion, really, typically if you're doing percussion to the abdomen, tympani will be heard basically on the entire abdomen. Dullness will be over like maybe the liver or the spleen. You want to make sure that when you are percussing, you hear of the term CVA tenderness, costovertebral angle tenderness. That's in the back by the kidneys around the 12th rib. When you kind of tap on it, you shouldn't have any pain. So if you do have pain, then that would be called CVA tenderness. Um, and then with palpation, just remember you start off gently and then progress into deeper palpation, but make sure that you respect the client's comfort. And, when we're talking about client teaching, we want to make sure that, this is a, important part of the puzzle. You want to educate your patients on maintaining a balanced diet, making sure that diet preventing obesity, remove any kind of gastric irritants. You want to educate them about that. Um, Discourage regular laxative use. Advise them on modifying any kind of lifestyle changes that may cause gastric irritation. So, like spicy foods. Really stress the importance of regular physical examinations. And if the patient has any gastrointestinal concerns, please tell them to promptly talk to their healthcare provider because, we really want to make sure that our patients are informed, about their healthcare. And so that concludes today's segment. So congratulations, nursing scholars. We've gone through the abdominal assessment. Remember, this is an overview, but hopefully I've given you all the nuggets that you need, you know, um, and, I hope that you apply these skills to your nursing practice. And I want to say your dedication to learning and shaping um, your practice for the future. You're going to be the healthcare futures of tomorrow. So keep thriving, keep learning. Never underestimate the impact of a thorough assessment. Okay. Best of luck on your nursing journey. And until next time.